Let me ask you something important. Have you ever been told that seeds are one of the healthiest foods you can eat? High in fiber, packed with nutrients, natural, heart-healthy. That advice is everywhere. But here's the uncomfortable truth most people over 60 are never told. Some seeds, especially the ones promoted as superfoods, can quietly increase inflammation, worsen joint pain, stress your heart, and even accelerate aging when eaten the wrong way. And the reason is simple. Your body after 60 does not process food the same way it did at 40. Digestion slows, mineral absorption drops, inflammation becomes easier to trigger. So foods that once helped you can now quietly work against you. In today's video, I'll explain 4 seeds seniors should avoid. 4 seeds that can truly support aging bodies. Why preparation matters more than the seed itself, and how small changes can reduce pain, fatigue, and stiffness. Everything I'll share is based on nutrition science, geriatric research, and clinical experience. Before we begin, tell me in the comments, what seeds do you eat most often? Have you noticed bloating, joint pain, or fatigue afterward? I read the comments, and they help guide future videos. Now let's begin, calmly, clearly, and honestly. Dakru, Part 1. The seeds that can harm you after 60. Dakru. Number 4. Sunflower seeds. Sunflower seeds are everywhere, on salads, in granola, inside healthy snack bars. And yes, they contain vitamin E. But here's what matters more for seniors. Sunflower seeds are extremely high in omega-6 fatty acids. Omega-6 fats are not bad by themselves, but imbalance is the problem. After 60, your body becomes far more sensitive to inflammatory signals. Large nutrition studies show that seniors do best with an omega-6 to omega-3 ratio close to 4.2. Regular sunflower seed consumption can push that ratio to 15.1 or higher. What does that mean in real life? More joint stiffness, swollen ankles, higher arterial inflammation, fatigue that doesn't improve with rest. I've seen this many times in clinic. One patient, a 72-year-old woman who walked daily and ate clean, was unknowingly adding sunflower seeds to nearly every meal. Her inflammation markers were elevated, not from disease, but from diet imbalance. Once sunflower seeds were removed and replaced with gentler options, her swelling improved within days. Sunflower seeds aren't poison, but daily consumption after 60 can quietly push the body toward inflammation. Number 3. Cottonseed oil, hidden seed danger. Now let's talk about a seed most people don't even realize they're eating. Cottonseed. You'll rarely see cottonseed listed clearly. Instead, it appears as cottonseed oil inside crackers, baked goods, salad dressings, processed snacks. Cottonseed oil contains gossypol, a naturally occurring toxin used by the plant as protection. In younger bodies, small exposure may be tolerated, but in seniors, detox systems work more slowly. Research has shown gossypol can interfere with heart electrical signaling, worsen muscle fatigue, disrupt cellular energy production. I've seen patients develop unexplained fatigue, muscle twitching, heart rhythm discomfort that resolved simply by removing cottonseed oil from the diet. If you're over 60, cottonseed oil offers no health benefit and carries unnecessary risk. Always check ingredient labels, especially on low-fat foods. Number 2. Sesame seeds, when overused. This one surprises many people. Sesame seeds are often marketed as healthy, and in small amounts they can be. But for seniors, sesame seeds present 2 issues. First, phytates. Phytates bind minerals like calcium, magnesium, and zinc. Nutrients older adults already struggle to absorb. Studies show high phytate diets can reduce mineral absorption by 20–30% in older adults. Second, adult-onset sesame sensitivity. In recent years, sesame became an officially recognized allergen, with many reactions appearing after age 50 gakinai. Symptoms are often subtle: joint pain, sinus congestion, skin irritation, chronic bloating. I've seen long-term mystery inflammation resolve simply by removing sesame-based foods like tahini. Sesame isn't inherently bad, but hot frequent consumption after 60 can quietly drain minerals and trigger immune stress. Number 1. Chia seeds. When used incorrectly, this is the most misunderstood seed on the list. Chia seeds are praised everywhere, but here's the medical truth. Chia seeds can absorb up to 10-12 times their weight in liquid. In seniors with slower digestion, reflux, reduced throat lubrication, dry or poorly soaked chia can cause severe bloating, intestinal blockage, esophageal obstruction. There are documented emergency cases, including hospital removals, from improperly consumed chia seeds. Chia is not dangerous when prepared correctly. But eaten dry, powdered, or lightly mixed with food, it can become a silent risk after 60. That's why I never recommend chia without strict preparation guidance. Now that we've talked about the seeds that may quietly work against you, let's do something far more important. Let's talk about the seeds that can support your body, calm inflammation, and help you feel steadier, lighter, and stronger as you age. This is not about trends. It's about what older bodies actually tolerate and benefit from. Number 4. Black sesame seeds. This may sound confusing after what we just discussed about sesame, but black sesame seeds are not the same as the white, polished sesame used in buns and tahini. Black sesame seeds are unhulled, less processed, naturally richer in minerals, traditionally used in small medicinal amounts. In Eastern nutrition, black sesame has long been associated with vascular support, brain nourishment, healthy aging. Modern research supports this. A study published in the Journal of Nutritional Biochemistry followed adults aged 65 to 78. Those who consumed small daily amounts of black sesame showed improved blood pressure regulation, better memory recall, reduced oxidative stress. In practice, I've seen older adults feel clearer mentally, steadier when standing, less mentally fatigued when black sesame is used properly. And that's the key. Black sesame should be used in small amounts, ground or gently soaked, never eaten in excess. 1 to 2 teaspoons per day is plenty. This is not a snack food. It's a supportive addition. Number 3. Flax seeds. Flax seeds are one of the most underrated foods for seniors. They don't look exciting. They're not heavily marketed, but what they do inside the body is remarkable. Flax seeds are rich in alpha-linolenic acid, a plant-based omega-3, lignans that support vascular and hormonal balance, gentle fiber that supports digestion. Clinical studies show flax can lower blood pressure, improve cholesterol balance, support regular bowel movements. In older adults, this matters enormously. I've worked with patients who struggled for years with sluggish digestion, stiff arteries, abdominal discomfort, and saw consistent improvement once ground flax was introduced slowly. The preparation matters. Flax must be ground, not whole. Whole flax often passes through the digestive tract untouched. It should also be added to cool or warm foods, never cooked at high heat, stored in the refrigerator. Start with half a teaspoon per day. Build slowly. Gentle consistency beats aggressive dosing every time. Number 2. Pumpkin seeds. Pumpkin seeds are one of the most senior-friendly seeds available. They are soft, easy to chew, easy to digest, and they are rich in 2 minerals older adults often lack: magnesium, zinc. Magnesium supports muscle relaxation, nerve signaling, sleep quality. Zinc supports immune function, wound healing, muscle repair. Studies show that older adults with low magnesium often experience leg cramps, restless sleep, muscle fatigue. Pumpkin seeds help restore that balance naturally. In practice, I've seen seniors report fewer nighttime cramps, deeper sleep, less muscle tension with just a small daily portion. A small handful, unsalted, lightly roasted or raw, is enough. This is food as nourishment, not supplementation. Number 1. Hemp seeds. If there's one seed I consistently see older adults tolerate well, it's hemp seeds. Hemp seeds contain a near-ideal omega-3 to omega-6 ratio, gamma-linolenic acid, which supports joint comfort, easily digestible plant protein. They are soft. They don't swell aggressively like chia. They require no soaking or grinding. Research in older adults shows hemp seeds may help reduce inflammation markers, improve lipid profiles, support muscle strength. What I like most as a clinician is how gentle they are. Even seniors with sensitive digestion, dental issues, low appetite often tolerate hemp seeds without discomfort. 3 tablespoons per day, mixed into yogurt, soup, or smoothies, is a simple, realistic habit. Shakurse, bringing it all together. Here's the real takeaway. After 60, nutrition is no longer about healthy labels. It's about tolerance, balance, and preparation. Some seeds quietly inflame, others gently nourish. Your body tells you the difference, if you listen carefully. You don't need to fear food. You need to choose wisely. Now let's slow everything down and put this into perspective. Because after watching a video like this, it's easy to feel confused or even worried. And that's not the goal. The goal is clarity, not fear. The biggest mistake seniors make with healthy foods. One of the biggest mistakes I see in people over 60 is assuming that a food is safe, just because it's labeled healthy. Seeds are a perfect example. At 30 or 40, your body can tolerate things differently. Digestion is faster, inflammation resolves quicker, the gut barrier is stronger. After 60, the rules change. That doesn't mean your body is weak. It means it needs different support. The problem is not seeds themselves. The problem is eating the wrong seeds, eating them in excess, or preparing them incorrectly. That's when trouble starts. Why preparation matters more than the food itself. I want to emphasize this because it's often overlooked. How you eat something can matter more than what you eat. For example, chia seeds can be helpful, but only when fully soaked. Flax seeds work, but only when ground. Sesame can nourish, but only in its unrefined form and small doses. Older digestive systems do not respond well to extremes. They respond best to gentleness, consistency, moderation. This is why traditional diets, especially in long-living cultures, use seeds as supportive foods, not main ingredients. Dakri, a simple daily rule for seeds after 60. If you want a simple rule you can actually remember, here it is. 1 to 2 types of seeds per day is enough. Not 4, not 6, not everything mixed together. Choose one seed that serves your main need: joints, digestion, sleep, inflammation. Rotate them during the week. Your body likes rhythm, not overload. Dr. Weiss, signs a seed is not right for you. Your body always gives feedback, you just need to notice it. After eating seeds, pay attention to bloating, joint stiffness, skin irritation, unusual fatigue, stomach pressure. If something feels off, don't ignore it. It doesn't mean the food is bad. It means it's not right for you right now. And that's okay. Nutrition after 60 should feel supportive, not stressful. Why seniors feel better. When they simplify, one thing I've seen again and again in my patients. When seniors simplify their diets, their bodies often respond quickly. Less inflammation, more stable energy, better sleep, not because they added something magical, but because they removed what didn't belong anymore. Sometimes healing begins with subtraction. A gentle reminder about medical care. I also want to be very clear about something. This video is educational. It does not replace medical care. If you have digestive disorders, swallowing difficulties, chronic inflammation, or are taking blood-thinning medication, always talk to your healthcare provider before making major dietary changes. Food is powerful, but it must be used wisely. Final thoughts. Aging does not mean decline. It means adaptation. Your body is still incredibly intelligent. It just needs the right inputs. When you choose foods that respect your age, your digestion, and your inflammation levels, you give your body the chance to work with you, not against you. Gentle CTA, doctor style, calm. If this video helped you see food differently, or made something finally make sense, take a moment to let us know in the comments. What seed surprised you the most? And what is the one thing you struggle with most right now? Joints, digestion, or sleep? We read every comment, and your question may help someone else feel less alone. If you'd like more calm, science-based guidance for health after 60, consider subscribing to the channel. We focus on clarity, not hype, and on helping you age with strength and confidence. Thank you for watching, and take good care of yourself.